afternoon, everyone, and thank you all for joining us for today's congressional briefing on the future of autoimmune disease research. I'm Molly Murray. I'm President and CEO of the Autoimmune Association, and I'm honored to welcome you on behalf of our organization, along with several of our valuable partners and co-hosts for today's briefing, many of whom are in the room representing their organizations here today. They include the Arthritis Foundation, the Celiac Disease Foundation, the Crohn's and Colitis Foundation, the Lupus Foundation of America, the National Psoriasis Foundation, the National Scleroderma Foundation, and the Sjogren's Foundation. Together, we are proud to host this pivotal moment in the history of autoimmune research, a moment that promises to shape the future of science, care, and hope for the millions of Americans living with these complex and often misunderstood conditions. Approximately 50 million Americans across every state, district, and community are living with autoimmune diseases. They are chronic, often disabling, and frequently invisible conditions that place a staggering burden on patients, families, and the healthcare system. While the exact prevalence unknown due to a lack of comprehensive longitudinal data, rates of autoimmunity are clearly on the rise. While no official federal estimates exist for the full economic impact of autoimmune disease, current projections for just 29 of the more than 140 autoimmune conditions put the annual cost at around $180 billion in 2025 dollars, which is just staggering. And that's only part of the picture, and that's what today's briefing is all about, why this matters. In 2019, bipartisan leaders in Congress recognized that autoimmune diseases were affecting a rapidly growing number of Americans, yet federal research efforts remain fragmented, inconsistent, and underfunded compared to other major disease areas. To better understand the problem and recommend solutions, Congress directed the National Institutes of Health to commission a comprehensive evaluation of the federal autoimmune research landscape and to contract with the National Academies of Science, Engineering, and Medicine to identify and review NIH's research efforts in the broad area of autoimmune diseases. In 2022, that roadmap arrived. The NASM report on autoimmunity called for a coordinated federal strategy to bring, thank you so much, to bring the full weight of science, policy, and innovation to bear on autoimmune diseases. Congress responded by directing the NIH to establish the Office of Autoimmune Disease Research within the Office of Research in Women's Health in the Office of the NIH Director. This marks the first time autoimmune disease has had a dedicated federal health with a mission to coordinate research across NIH's many institutes and centers. This represents the most significant structural advancement in autoimmune research policy to date. We are deeply honored to be joined today by his inaugural director, Dr. Victoria Shanmugam, here, who is leading this effort to ensure that autoimmune diseases are no longer sidelined in research, but approached with the urgency and strategy they demand and very much deserve. To help set the stage for today's discussion, we're joined by Dr. Nina Looney-Pratt, Chair of the Autoimmune Association's Medical and Scientific Advisory Council. Dr. Looney-Pratt is a physician scientist at the University of Pennsylvania and a leader in clinical immunology and systems biology. She brings both scientific clarity and human compassion to this work, and we're so honored she's here today to help frame why this moment matters and to introduce the new federal office leading the way forward. Please join me in welcoming Dr. Nina Looney-Pratt.
Thank you so much, Molly. Can you hear me okay back there in the back? Yeah. Someone's saying, like, okay, good. Well, thank you again. It's my privilege to be here today to serve also as the chair of the Medical and Scientific Advisory Council of the Autoimmune Association. And in that role, I could not be more proud. It's a little, okay, how's that? Is that better? I could not be more proud of the work that everyone is doing including our colleagues in the NIH and the many patient advocacy groups that are gathered here today. As a scientist, I strongly support the investment that are outlined in the NASEN reports, which I'm going to describe for you in a minute, and view them as essential to advancing our understanding of autoimmune disease. Research in this field is evolving rapidly, and it has become increasingly clear that we cannot afford to think about autoimmune conditions in silos. The complexity of immune dysregulation demands collaboration across diverse specialties, and if we are to accelerate progress and improve outcomes, we need to get together on this. To provide a high-level overview of this important report, I have the honor of sharing some prepared remarks from Dr. Betty Diamond. Dr. Diamond served as one of the primary reviewers of the NASEN report and is very familiar with all of its findings. As a leading rheumatologist and internationally recognized expert in SLE, systemic lupus erythematosus, Dr. Diamond brings a vital scientific perspective that to the challenges and to the opportunities that are outlined in this report. So now I'm going to quote for you Dr. Diamond. I have spent a 4-decade-long career studying autoimmune diseases and caring for patients with conditions such as systemic lupus, rheumatoid arthritis, myositis, and more. And what have I and my colleagues across the country learned? Autoimmune diseases are complex, diverse, and deeply burdensome. They often strike at a young age, and they last a lifetime, profoundly affecting the quality of life. As Molly just mentioned, an estimated 50 million people in the US live with some form of autoimmune disease. That is a staggering number. The economic toll is, as Molly also mentioned, staggering, but the personal toll is even greater. Everyone knows someone who is affected by autoimmune disease, and yet our national investment in autoimmune disease research does not reflect either the prevalence of these conditions or their immense human and economic cost. I would like to highlight what I believe are the most important conclusions of the NASEN report. Autoimmune diseases are on the rise, and the new autoimmune diseases that are being identified, that there are new autoimmune diseases being identified every year. While each of these diseases has unique features, many share symptoms and biological pathways. Autoimmune diseases encompass a wide range of conditions, each with its own diverse manifestations. And while there are important distinctions between them, many also share common underlying mechanisms. And this is really a key point because it highlights the need for both disease-specific and cross-cutting research efforts. We need more coordinated human studies that are both within single diseases and across different autoimmune conditions that share symptoms like fatigue, chronic pain, or brain fog. We also need better tools to identify people at risk before symptoms appear so that we can intervene earlier and hopefully prevent lasting damage or even prevent the disease entirely. Finally, centralizing research efforts will allow us to adapt therapies across diseases and better understand shared genetic and environmental risk factors. The establishment of the Office of Autoimmune Disease Research was recommended to serve the function of overseeing and coordinating the research agenda and the research portfolio, and leveraging resources for maximal efficiency. As you will hear, it has done a fabulous job, but its work is not done until we have cures and prevention strategies, and autoimmune diseases cease to be a major cause of morbidity and mortality. That's the end of my quote for Dr. Diamond. She's amazing. So I really want to thank Dr. Diamond for her insights and her deep and lifelong commitment to this field. And as Dr. Diamond mentions, and in my view I also agree with this, the NASEN report offers a blueprint for how to improve autoimmune disease research through better coordination by linking patient-centered work with basic biomedical discovery. And we really need research to be across a full continuum from pre-disease to early disease to advanced stages. We need studies that reflect the range of patients across the lifespan. We need predictive biomarkers to guide personalized treatment, especially since many patients live with more than one autoimmune disease, about 1 in 4 patients. And many have multiply affected family members. So we need to advance research to ensure timely, accurate disease diagnosis, as well as develop a better understanding of disease triggers. And if we're going to scale up clinical trials and cohort studies, we must build an infrastructure to support them. We must invest in clinical trial networks, data science tools, computational capacity, and a skilled workforce. And most importantly, we must maintain a continuous dialogue with patients, providers, and partners. So how do we accomplish this, you might ask? The first step was creating the Office of Autoimmune Disease Research. So that's done. The second step was developing a congressionally mandated strategic plan to set research priorities. While rooted in the NASA report, I want to emphasize that this plan belongs to the public. It was shaped not just by researchers and clinicians, but by patients and by advocates, including many of you here. Third, and most critically, we have to resource and implement this plan. So our job as advocates for autoimmune disease research is to make it clear to our elected representatives that autoimmune disease research requires dedicated funding. So what we need for that is line item appropriation for autoimmune disease research. Second, for programs to run effectively with this new model, we require sustained multi-year funding. Getting this right now will impact autoimmune disease potentially for decades to come. And thus it will impact the health of the American people. And finally, the Office of Autoimmune Disease Research needs to be independently functioning as an office. So it needs to be similar to the current Office of Nutrition Research or AIDS Research. Okay, so now I'll get off of my soapbox and introduce the real star of the show today, Dr. Shanmugam. Dr. Shanmugam is the director of the NIH Office of Autoimmune Disease Research. Dr. Shanmugam earned her undergraduate degree from Oxford University and her medical degree from the Imperial College School of Medicine at the University of London. She completed her internal medicine residency and rheumatology fellowship at Georgetown University and later served as professor of medicine and chief of rheumatology at George Washington University. Her research, funded by the NIH and other federal agencies, has focused on inflammatory disease, wound healing, and immune-mediated tissue injury. She is a fellow of the American College of Physicians, the American College of Rheumatology, and the Royal College of Physicians in London. Dr. Shanmugam is widely respected, as you can imagine, for her ability to bridge science, clinical care, and health systems leadership. She's also, in case you're curious, the host of ACR Journals on Air, the American College of Rheumatology's official podcast. Welcome, Dr. Shanmugam.
We're going to do an audio check. We can start. Am I good? Okay, we can hear me in the back. So thank you. Thank you, Mia, for that kind introduction. Thank you, Molly, for inviting me today. And thank all of you for coming to join us and learn a little bit about autoimmune disease. So I don't know, the star of the show. The star of the show is the strategic plan. And I'm super proud to be here today presenting this plan. So first, a little bit of background. So this plan came about as a result of a request from Congress made a couple of years ago. In the end of 2022, early 2023, in the Appropriations Act, Congress directed the NIH to establish the Office of Autoimmune Disease Research and the Office of Research on Women's Health, and specifically tasked the office with these 6 directives. Item 1 on this directive, I am presenting to you today the NIH-Wide Strategic Plan for Autoimmune Disease Research. We were also asked to identify emerging areas of research opportunity and collaboration, to foster collaborative research across the institutes and centres, to annually evaluate the autoimmune disease research portfolio, to provide more resources for planning, and to support a publicly accessible centralised repository. If you'd like to learn more about how we made progress on those other 5 directives, there is at the back of the room a printed out copy of our biannual report, the first 2 years of the office's activities. So we'll give you a little update on each of those. Take a copy for yourselves and a copy for your boss. And we'd be really grateful if you can get the word out. So when the office was formed, we were asked to consider in the portfolio of autoimmune disease research these 144 different diseases and conditions, all of which either are autoimmune in origin or coexist and co-occur with autoimmune diseases, and that we think may have an autoimmune pathology. It's a huge number of diseases touching every system in the body. Many of these diseases are systemic. And when we look across the portfolio of research at the National Institutes of Health, what I can tell you is this research area is funded across every single institute and center at the NIH. It is touched by everyone, owned by none. The research funding has increased over the last 5 years, but is still significantly lower than the impact of these diseases on the American people. How do we know? Because this is actually the prevalence of autoimmune diseases in the US, and I've put it into context with some common other chronic diseases that you all have heard about. So it's estimated that autoimmune diseases affect between 23.5 and 50 million people in America. In contrast, coronary artery disease, about 17 million people, COPD, or chronic pulmonary disease, about 16 million, Alzheimer's disease, about 6.7 million people, HIV, which is funded in an extremely different way, affects about 1.2 billion Americans as of 2021. So autoimmune diseases significantly higher prevalence and yet funded in a very different way. So the mission of the NIH-Wide Strategic Plan for Autoimmune Disease Research is to coordinate and advance efforts to support rigorous, high-priority, innovative and collaborative autoimmune disease research. And I'm going to tell you a little bit about PLAN, and then you can certainly read up on it, and there is a video online as well. So just a little bit of background into autoimmunity. Why has it been historically so hard to study? We don't really know what the drivers of autoimmunity are. We know that there are some genetic predispositions, and we think that over the course of our lifespans at different points in our lives, various environmental exposures increase the risk of autoimmunity. But studying this transition from someone having a balanced immune function to developing asymptomatic autoimmunity and then symptomatic autoimmunity has been very challenging because we don't really know the time point at which that transition occurs. What we do know is that many people with autoimmune diseases have had symptoms typically for several years at the point at which they're diagnosed, and very often they know they're sick for some period of time before their physicians are able to tell them that they're sick. And this tells us that there is this phase of asymptomatic autoimmunity that we should study further. The other important thing to realize from this slide is we've learned a lot from some autoimmune diseases that have been well studied, and the classic one is type 1 diabetes. So type 1 diabetes very commonly affects children, and siblings of kids who have type 1 diabetes are at much higher risk of developing type 1 diabetes. And it turns out that there is now a mechanism by which we can give an immune modulating drug at the point where that sibling has developed autoantibody, but before they've developed full-blown disease, and delay progression to full-blown disease. So what this tells us is there is this window of opportunity where we can intervene sooner and impact outcome. One of the things that we have started to look at over the years is how do we integrate understanding of the various exposures across our lifespans that could impact the immune system. And I want to think of this a little bit like, the early days of Google Maps. Some of you may not remember this, but it used to be very flat, didn't have all those layers on it. It used to be just the roads of the map. And then over time, they were able to layer on the external images and satellite images and where are the shops and how can I get to the nearest coffee shop. And so kind of similar, what we're wanting to do in science is with the scaffold of understanding how the immune system is working, layer on the different pathways that could be driving these mechanisms. So what went into this strategic planning process? There was a large amount of information that was collected and collated and put together. We had an internal coordinating committee for autoimmune disease research at NIH that kind of gathered all of this information and collated it. We did conduct a large portfolio analysis across the NIH to look at what is currently being funded, how is it funded, where is it funded. We put out a request for information from the community, which I'll tell you about in a second, hosted a couple of community roundtables, and then over the last 18 months have put that together into this strategic plan. And this kind of gives you the timeline of that process. It's been a very active process. We met monthly throughout this time, and it has really taken a village to actually get this to the point of publication. So just in terms of the request for information, if you're wondering what information to get from the general public, this is now published and online. You can download it from our website. We asked the public about their advice and what they would want you to see in a strategic plan for autoimmune disease across these different 4 objectives. And we also hosted 2 public community roundtables back in February of 2024. I have a couple of quotes from some of those respondents, just kind of giving you a feel for some of the information that went into this strategic planning process. And people were really helpful. They gave us really good advice. They told us what they wanted to see in this plan. And we spent a lot of time reading these, thinking about how to integrate this into this future-looking plan. We also took a lot of information from the original Mason report, which has been mentioned several times. This is actually a book that I carry to from work with me every day. I've got bookmarks in it, and I think Molly can attest to that because she's seen me carrying my dog-eared copy around. The report actually had a number of opportunities highlighted, and our strategic plan working group has worked really hard to try and integrate some of these areas of opportunity into what this forward-looking plan can do for autoimmune disease research. And so here it is. This is the strategic plan on one page. If you've got a copy sitting in front of you, you should have a printout of this, and I'll try and get you my copy. But it should have the priorities and objectives listed, and then the kind of bubbles for you to look at. And what I'll do is walk you through each of the priorities and their sub-objectives, and then the cross-cutting themes. But under priority 1, fundamental research is obviously essential. So this is really focused on accelerating basic scientific discovery and diagnosis, treatment, prevention, and cure of autoimmune diseases. We have 4 sub-objectives to support research into fundamental mechanisms of autoimmunity, to understand the drivers of autoimmune disease, symptoms, signs, and then something that's very important to patients, such as flares, the unpredictability of flare, and how we can better predict that and understand what drives it. Optimized further research models, and that includes both animal models and non-animal models, which we're looking into a lot more now at the NIH, but also computer models and ways that we can perhaps use things like digital twins to accelerate some of the clinical trial work that we need to do. And then improve understanding of predictors and risk factors for autoimmunity. So really understanding these factors that drive some of these risks of both a single autoimmune disease and then developing co-occurring autoimmune disease. Under priority 2, we wanted to focus and promote research focused on enhancing health for people living with and at risk for autoimmune diseases. So this includes looking at preclinical autoimmunity, which is emphasized as a really important window to accelerate research and accurate diagnosis, to look at improving treatment, and to support not only getting the treatments to bedside, but also getting the treatments to all patients with autoimmune disease. So this concept of implementation science, a job is not done until the treatments reach the patient. And priority 3 is focused on really understanding the full complexity of autoimmune disease. This is where we have felt it's important to study cohorts of people living with autoimmune disease and at risk for autoimmune disease, to study how different populations are affected. We emphasize very much facilitating clinical trials for autoimmune diseases. And then another point raised in the Mason report was that we need to research co-occurring and comorbid conditions along with autoimmunity. So that is the concept of if you have one autoimmune disease, you're at significantly higher risk of developing a second autoimmune disease. And actually, historically, because of the silos of our research, that has been very difficult to study because we tend to look at research in organ system focus. Under priority 4, one of the emphasis was really on capacity building for autoimmune disease research, and so this is where we wanted to focus on infrastructure development of trial networks, registries, data science and computational tools, and then supporting efforts to develop and sustain the scientific workforce. And under priority 5, we really wanted to focus on building and strengthening partnerships and interdisciplinary collaborations. And we're doing this in a number of ways. There are some ongoing activities across NIH that do leverage public-private partnerships, but we really want to expand and grow these. So public-private partnerships to support autoimmune disease research, engaging with people living with autoimmune disease and the advocacy groups and caregivers, partnering with communities that are disproportionately affected, and then really coordinating and fostering collaborative research. Woven into the strategic plan, we have 5 cross-cutting themes that really work throughout these different priorities and objectives to harness technologies, to develop infrastructure, to support data-driven approaches, promote engagement, and to support community partnerships. So this is kind of something that we think is part of the fabric of this plan. So I hope that you take time to take a full look at the strategic plan. You can download it online. There is a video online if you'd like to see the NIH director gave some opening remarks yesterday to present the strategic plan to the community. And I think kind of spoke to the importance of autoimmune diseases as the most common chronic disease population in the United States, and that focusing on this will really have major impact on the health of our people. So implementation of this plan will obviously be a partnership, both with researchers and scientists, the NIH, and our advocacy and community groups. What we have tried to give you is a framework, a roadmap for the next 5 years, but really think of this as the beginning, and that implementation will take not only building and extending some of the existing programs, developing some novel programs, and then really focusing on some bold initiatives to support autoimmune disease research. So this was not done alone. I lead the Office of Autoimmune Disease Research in the back of the room. Carmen and Shinray are 2 staff as program officers in my team. We are a small but mighty team of 3 people. We had a large strategic plan working group with representation from across the NIH. Every institute and center was represented. These individuals were incredibly active in this strategic plan working group. We've met monthly over the course of the last 18 months. And every word in this strategic plan was a team effort. Every word in there is in there for a reason. We hope that you will take a deep dive into it and share it with your communities. I want to thank you for listening, and I'm happy to take any questions from any of you about the strategic plan. Do you want to sit here?
Shall we sit here?
Do I need to turn this one off?
Yes. Actually, take it. That's Thank you.
The lights are very bright.
Yes, I'm staring at the lights instead of being able to see your faces. So don't be shy. Does anyone have a question? I tell you what, I can start with one. Let's see how this goes. All right, so Dr. Shanmugam, if addressed, if we are able to start implementing this plan, what would it look like in terms of being able to scale it up?
That's it. Not if, but when.
Okay.
So we are very keen to see implementation of this plan, and I can tell you that the institutes and centres are keen as well, and are looking already at what can we do with existing programs, and then obviously what can we do assuming there is ongoing funding to support this initiative. When we put this plan together, the strategic plan working group really thought very deeply about coming up with a plan that is very future-looking. That we can't necessarily predict today what things are going to look like in 5 years. How is the science going to evolve? But what we wanted to develop was a roadmap that would allow us to grow with the science as a field and to help lead the way in terms of where we should be going as a nation in researching this disease area. And so we really kind of developed this with the thought in mind of this can be scaled as funding increases, and that we will be course adjusting as the science evolves.
Yeah, I think it's very clear from the way the plan is written that it's broad and cross-cutting. And I think it brings to light a fundamental dilemma that we have in terms of thinking about human disease, that in the NIH right now, the institutes are organized around organ systems. This plan is very different. You want to comment more on how cross-cutting it is with respect to the diversity of autoimmune diseases and how right now the institutes are tricky in this regard? The compartmentalization.
Well, so I mean, you could question even the office name has Autoimmune Disease Research as opposed to Autoimmune Research. Agree. Yes, if you start with disease, you start with manifestation of disease, and that inevitably leads you to, which organ is affected, and that it's often a challenge both in clinical medicine and then also in research. And it does mean that things sometimes don't get studied in the most efficient way. What we're trying to do is move from looking at the ultimate impact of disease to thinking about what immune mechanisms might be driving disease and how can we harness what we understand about those immune mechanisms to better target therapy and to better identify treatments and potentially cures for these diseases.
Yeah, and I think that's a very exciting direction because immune mechanisms could be shared by different diseases, right?
Exactly, and I think one of the things that was highlighted in the NASA report and has been a very big priority of the strategic plan working group is this concept of co-occurring autoimmune diseases. We know if you have one autoimmune disease, you're more likely to develop a subsequent autoimmune disease, but it's actually in the current research paradigm somewhat challenging to study co-occurring autoimmune diseases. So, for example, it's quite common for somebody with rheumatoid arthritis to also develop Sjögren's disease. And yet, it's quite challenging to do scientific studies that look at the pathways of rheumatoid arthritis and Sjögren's disease, even in the same patient. What we wanted to do is kind of come up with a plan and a strategic vision that would allow our scientific community to really answer those questions that until now we've not been able to study and answer, and give them a structure to let them fit their science in.
Yeah, and I think so it's really great to do this, I think, because if you focus on pathways, those can lead to therapies. And potentially those pathways could lead to therapies for people who otherwise wouldn't have any, right? Because we have so many, like we said, over 140 some autoimmune diseases, might even be more than that. And every day new diseases are being discovered. And for some individuals, some of these diseases are very rare. And there's not a lot of resources to figure out how to take care of these people. But if you can find out whether somebody with a rare disease has a shared pathway with somebody with a more common disease, then maybe you could treat the rare disease, right?
I think that's really important. I think it would also give you a lot of insights into, we know people with autoimmune disease actually have a higher risk of cardiovascular disease. So learning more about what the immune drivers of these diseases are will help us understand other common diseases too. And I think, we have had a massive evolution of science over the last 20, 30 years. We've really changed paradigms of how we treat people living with these diseases. Now we have quite targeted therapy. We have a number of what we call biologic therapies, so we're developing antibodies or cells that will block particular pathways in the immune system. So the potential for being able to modulate the immune system has completely shifted in the last 20 or 30 years, even since I started practicing medicine. And what that means is that we have a better understanding of how these pathways might be shared across different autoimmune diseases. And it's quite common, actually, for some of these drugs to be developed for one disease and then repurposed for another. But we're at a place where if we are more coordinated in how we approach research and supporting research, then we can really accelerate that process much more quickly. We have a model for that. It's been done actually in cancer for many years. The National Cancer Institute developed in, I think, 1937, so about 80 plus years old. And they have gone over those 80 years from a group of diseases that they grouped together under a single umbrella of cancer, but obviously were affecting different organs, to these very targeted molecular treatments for cancer that have completely changed the course of disease. And so what we are hoping this strategic plan will be for the community is a starting place, a kind of initial step in the roadmap towards what the future could look like. And obviously, 5 years is not long enough, but that hopefully this will set the direction for the future of autoimmune disease research in the United States.
So I want to see if there's anyone in the audience who has got the courage to ask a question. Still no takers. Okay, but if somebody has a question, just raise your hand and shout out. Okay, but one of the things that you mentioned, Dr. Shanmugam, was collaboration.
Mm-hmm.
And I think that's the word that I'm hearing repeatedly in today's conversation. So I think collaboration and partnerships seem to be a really critical component of the plan. Can you discuss some of the key partnerships, including those with private institutions, interdisciplinary collaborations with other research bodies that the NIH hopes to foster to advance autoimmune disease research?
Absolutely. So we are sort of hoping that this framework will help people collaborate across some of the silos of research, it will allow people to see opportunities. One of the things we're very excited to help our scientific community collaborate on is this concept of co-occurring conditions. We actually specifically issued from the Office of Autoimmune Disease a request for research proposals from our intramural community to study co-occurring autoimmune diseases, and specifically asked for the researchers to collaborate across different institutes and centers. We got a huge number of applications, many more than we could fund, and I was thrilled to see that the scientists are really excited to do this work. And so that was kind of an initial foray into how can we help scientific collaboration across some of these boundaries. Something that we've done on the extramural side was there is an existing network in the National Institute of Allergy, Immunology, and Infectious Diseases called the ACE network, or Autoimmune Centers of Excellence. There are 5 of these for the whole country, so this is a small program but mighty. And what we were able to do from the Office of Autoimmune Disease was support an introduction of a new center focused on autoimmune endocrinology. This is really exciting because autoimmune thyroid disease, autoimmune adrenal disease, these are diseases that we typically do not treat with immune suppressing medication. And what this did was brought in a new group of scientists into this group of existing collaborating scientists who study the immune system and allowed them to collaborate across these barriers of disease area to think about, well, how can we understand the immune system in some of these endocrine diseases and scale that across other autoimmune diseases. It's been an incredibly invigorating collaboration to watch, and I would love to see more of those collaborations.
Right. Yeah, and I think it's a great point because autoimmune thyroid disease is actually quite common and can often co-occur, right?
Very common. I think somewhere around 12% of the population has autoimmune thyroid disease.
12%. There's a question.
Yeah.
Okay, let me bring the mic over to you.
Excellent.
My name is Veronica Spian. I represent Amateur International Health Movement. We actually also did an analytical work. I told you already before, right, about the microplastic. So the question is, are you actually studying this? So are you focusing on that too? I know you do, right, in the environmental. And are you considering also the microplastic part of the issue of the autoimmune disease? And also one of the points is which we, for example, find out why the microplastic is so much dangerous, because we know it's big plastic that ended up in the ocean, then it goes to microplastic, then to nano, right, to nanoparticles, then the ocean evaporate and we freeze it. And that's also one of the most dangerous things, which could be. And actually, the nanoparticles can have the charge, the electrical charge, because it's like in the ocean, in the water, it can be like that. And that's the one thing which actually allows to these nanoparticles to penetrate every single cell in our body. Do you have studies on that? Do you have maybe you can do some things about that?
Thank you for that question.
So we do. So the Office of Autoimmune Disease funds, in conjunction with NIAMS, who I think are somewhere in the room, I see them in the back of the room, so the National Institute of Autoimmune or Arthritis, Musculoskeletal and Skin Diseases, a program called Exact Plan, which is focused on exposures, and this is a variety of different exposures, including microplastics, including other environmental exposures, but really focusing on how do we come together to study these across the lifespan of people at risk for autoimmune diseases. So there's a group in that collaboration who are studying particularly pediatric autoimmune diseases, and then there are a number of groups that study other environmental exposures across adult autoimmune diseases, and that is something that we have spent a lot of time trying to build and grow that collaboration and hope to see it continue to thrive.
Yeah, I think it also highlights the need potentially for more broad-ranging studies that are both longitudinal and also that collect data of different types of encounters that people have over the course of their lifespan.
Yeah, and I think that is something that historically has been challenging to do, but we have actually lots of different data sets that are enabling us to start to look at some of these questions. And I think as science is evolved, data science has also thankfully evolved, and we have a lot more computational modeling now that has allowed us to start to really better understand some of those data sets too.
Yeah, and I think to try to link exposures, for example, to specific phenotypes of disease is very challenging. You have to study large numbers of people and have very massive data sets. So I think this certainly help with that.
Yeah, I think it's a first step, and I think what we need now is the community to come together, for the scientific community and all of our partners across the community to come together to think about, how each and every one of us can play a role.
Any other questions? Excellent. Here I come.
Yeah.
Actually is bouncing off of your comment about large data sets. And I'm curious about your personal vision for the infrastructure. So it is going to take a lot of data sets per disease, cross disease, and several of us were at the UFAME program recently, where there's a great repository being built to do just that. I'm curious if your vision is a centralized repository that you can go across all agencies, however they check out later, including the work that the Foundation for NIH is doing. So we have massive data sets to crunch the data. Is that where you're thinking?
Great question, and it's something we put a lot of thought into. There are, and many of you may be aware of this, there are many different data sets already in existence, some studying particular disease, some studying diseases across the lifespan, some studying people at risk of disease over the course of their lives. And one of the things that's been missing, for many years missing, is how do we develop infrastructure that lets us better use existing data sets. And to answer questions that maybe 10 years ago we didn't have. So this kind of concept of how can we harmonize data, existing data sets, how can we build on existing data sets to answer the questions we have today, to answer the questions we're going to have 30 years from now. And I think as the science has evolved, as I said, thankfully, computational techniques have also evolved. We've been working very closely with the National Library of Medicine, who are obviously experts on data science, to try and develop a platform for using a federated data model across autoimmune disease research. And what does that mean? That is a mechanism by which we can allow existing data repositories to be analyzed in place. So these are data sets that perhaps are sitting in, say, a particular disease-focused foundation, or a particular hospital system, or a single scientist's lab that they've been toiling in for 30 years of their career on, and starting to make those usable both by both scientists and then by other scientists they want to collaborate with, and doing that in a way that allows the data to remain safe, secure, protects patient privacy and all of those important factors, and that allows the scientists that have been critical in developing that data to also play a role in that analysis of that data. So that's something we're actively working on. Actually, it's kind of how we're approaching that congressional aim 6. So if you'd like to read a little bit more about it, there is a whole page on it in the annual report in the back of the print. And watch this space, because I'm hoping that as the next few years evolve, we'll be able to tell you more updates on that. We have been talking to a number of different groups across NIH where there are existing repositories of data that are focused in autoimmune disease, including the AMPAIN program, including imports, including a number of labs at NIH. Some of those scientists are here in the room today. But this is something that I think the community has needed for some time, and I think we're now at a place where we have the computational infrastructure to actually be able to see this become a reality.
Then also the Immune Deficiency Foundation. I think what you're doing is great. It's definitely needed, like the studying more fundamental things like the immune system and how all the different things interact. How do we, support this kind of effort? Well, as I know a lot, we all know that there's concern and threats about funding generally for NIH things that are already being done. We don't want to see, things that are promising in other areas of NIH. So I don't know if there's recommendations about how to do that.
That might be a tricky one.
I don't know that I have specific recommendations, except to say, I see this as studying the immune system is going to be crucial for the health of American people. And that this group of diseases, as Marlene mentioned, is increasing particularly in our young people, so in adolescents and people in their early adulthood. And so I think we have to think of this really as a kind of investment in the future health of the American people, and we can't really afford not to make that investment.
You had a question?
Yeah. So following up on the federated data model, are you guys able to do that kind of within the NIH structure, or do you need legislation or some policy changes in order to facilitate that?
So right now, we have rolled this out to some intramural investigators, and we are looking to also incorporate our group of investigators within the Exact Plan program, who have obviously been trying to look at these existing data sets and layer onto existing data sets some of these environmental exposures. So it's a particular area where this would really have a big impact and would be allow us to use as a test case to show that this data system would be beneficial. I can't speak to any need for legislative change. Actually, I don't know the answer to that question, but I think that we are very keen to explore, can this model be effective at allowing scientists to ask important scientific questions across distributed data sets in order to really advance the field.
Any other questions? Okay, well, I have a few final remarks. I think it's okay for you to watch inside. I'd be happy to. Anything else you want to say? All right. Okay. All right. Concluding remarks. So I wanted to leave you with the idea of comparing autoimmune disease research to cancer research. So cancer research has worked so well because cancer is a devastating disease that we all recognize its importance. It's well funded. But critically, cancer research is organized under one umbrella, irrespective of the disease type or the anatomic system. Rather, it's focused on disease pathways, and that's really where I feel like we need to go with autoimmune diseases. It's focused on pathways, it's focused on mutations, it's focused on the immune system, and it's focused on how you target a therapy for a patient's tumor. Well, how do we target therapy for a patient's autoimmune disease? The other critical thing in cancer research is that it's focused on cure. Too many people with autoimmune disease don't have cure as an option right now. It's a chronic, devastating, lifelong disease. And like cancer, we now actually have intensive therapies that have the potential to reset the immune system. Brief, intense, and targeted therapies are what are needed, followed by monitoring for essentially minimal residual disease like you have in cancer. And as Stuart Colton once had said, we have a war on cancer. Why can't we have a war on autoimmunity? So how do we do this? So here's our call to action. Three things we need. Funding through a line item appropriation for autoimmune disease research. That's number one. Number two, sustained multi-year funding. Can't plan if we don't have that. And number three, the Office of Autoimmune Disease Research needs to be able to independently function so that it can oversee the research, similar to how the Office of AIDS Research, for example, functions now. And finally, I just want to conclude with saying that we all know somebody who has autoimmune disease. And advocacy happens everywhere. Encourage everyone you know to promote these efforts to improve the health of millions of Americans. Thank you.
Thank you, everyone, and thank you, Dr. Shanmugam, for being here today to present the strategic plan. Very exciting. I think I speak for every patient advocacy organization in the room, and certainly our co-hosts that we're here to support you and any way we can to help bring the strategic plan to life and these next steps. Dr. Crack for your presence here today, for the Q&A. I want to remind everybody that we do have a reception downstairs. They'll be taking place for the next hours. Certainly, plan on coming down there and continue to get the conversation. Thank you. Thanks, everyone.